Hello, thanks for tuning in. Today we're talking about MAOIs, and I'm not talking about Hawaii. I'll see myself out. Actually, I'm talking about the psychiatric med, MAOI, or MAOI for short, which stands for monoamine oxidase inhibitors. Isn't that exciting? Yes, it is. So MAOIs are mostly used for depression and anxiety. They can be particularly helpful in treating atypical depression or treatment-resistant depression or social anxiety, panic disorder, and Parkinson's disease. They have also been found to be helpful with BPD or borderline personality disorder, obsessive compulsive disorder or OCD, PTSD or post-traumatic stress disorder, and bulimia. So a little bit of history for you, a little history lesson. In 1952, doctors were experimenting with something called iproniazid to treat tuberculosis. It was found that those who had tuberculosis as well as depression actually ended up having like a lighter mood, a better mood. They felt better overall, emotionally. They started marketing iproniazid or iproniazid. I'm not sure exactly how to say that, but iproniazid. They started marketing it as an antidepressant, and it is a monoamine oxidase inhibitor. So from 1957 to about 1970, older MAOIs were used. Their popularity actually declined after like 1970 when newer antidepressant drugs were introduced because their popularity declined because they interact really poorly with other meds. They don't play nice. And also they interact really poorly with certain food, which can actually lead to blood pressure emergencies. So not the nicest meds to be taking. Scientists later discovered that there are two types of MAO or MAO enzymes, now called MAO-A and MAO-B. They then figured out how to use MAO-B in drugs to decrease the side effects and the drug kind of interaction issues. And in 2006, the FDA in the United States approved the MAOI patch to be used for depression. So at this point, you're probably wondering, what does a MAOI even do? MAOIs inhibit the activity of monoamine oxidase enzymes in the brain, which then prevents the breakdown of monoamine neurotransmitters, making them more available in the brain for use. The brain has chemicals called neurotransmitters, and it uses those to send signals to throughout the brain and stuff to send signals about thoughts and feelings. Monoamine oxidase is a substance in the brain that specifically targets and breaks down monoamine neurotransmitters. And when those are broken down, of course, it limits their availability in the brain. And that is thought to cause depression in some people. So logically, if you are able to prevent that breakdown and keep them available and use in the brain, keep their usage up in the brain, then you can theoretically relieve depression. So that is one theory of depression. And that's an older theory, but it is a theory that is why MAOIs work. So MAOIs target specific neurotransmitters: serotonin, epinephrine, norepinephrine, and dopamine. Okay, so if you know anything about these chemicals, if you've heard of serotonin and dopamine before, you might know that they help you regulate your emotions. They essentially do regulate your emotions for you. And a lack of dopamine, a lack of serotonin can make you sad. There's a reason that I think it's serotonin is called the feel-good chemical because it makes you feel good. Enough of it makes you feel good. Lacking it makes you feel bad and sad and down and low and depressed. I realize that depression is more than just being sad or low. I know that. Trust me, I do. I have depression, but I'm just kind of summarizing and kind of simplifying it. So basically, MAOIs keep serotonin and dopamine and norepinephrine and epinephrine more available in your brain. It keeps your brain from breaking those down too much so that your brain can actually utilize them and help you feel good or maintain kind of positive, but also more regularly positive emotions, more neutral emotions as well, not just depressed emotions, essentially. I think you know what I'm saying, do you? Right? You know what I'm saying. You got it. Okay, so as far as effectiveness, they are pretty effective for some people. Unfortunately, they do have side effects, which is what we're going to get into now. They also have specific instructions and risks that come with them. So they're not the greatest med ever, but they help some people, and that's good. So basic side effects include nausea, diarrhea, constipation, dry mouth, dizziness, drowsiness, lightheadedness, and insomnia. So in order to avoid the serious side effects, traditional MAOIs require you to limit certain food and drink, which include tyramine, I think is what it is. I think is how you say that. Anyway, that includes cheese, Chianti wine, and pickled fish, just to list you some examples. But I mean, who doesn't want cheese in their life? I guess if you're a vegan, it's all good. But like, if you're not, and I would miss cheese, personally. Excess tyramine allows for development of more norepinephrine, which then can allow for blood level increases to points of fatality. Does that sentence I just said make sense? Lots of norepinephrine can be caused by tyramine, and lots of norepinephrine can cause fatal levels of blood pressure. There, that makes sense. Normally, monoamine oxidase breaks down the excess norepinephrine, but MAOIs prevent that from happening, which can cause an excess amount of norepinephrine, a dangerous level of norepinephrine in your brain. And that norepinephrine gets into your blood plasma, which increases your blood pressure level. Brands of MAOIs include Marplan and Nardil. Today, in this video, we talked about MAOIs, or monoamine oxidase inhibitors. Not Hawaii. Monoamine oxidase inhibitors. Say that 3 times fast. So they're mostly used with depression, as I said, and they're not as widely used today as some other antidepressants due to their limitations, I would say. This has been an introduction to psych meds, MAOI edition. Thanks for watching. I appreciate all 50 of you, and I'll see you when I see you.